It's always the one.
Right.
Don't do the left, because if you do the left, they get excited.
Just the right.
Yeah, this one.
Yes. Am I, yeah, oh my gosh. Okay. Okay. All right. What's this? Yes, ma'am. Oh, that's something else, okay. Exactly. Yes, because I don't want to be confused. We got everybody? 7:08. The meeting is now called to order. Can we please all stand for the Pledge of Allegiance? I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, liberty and justice for all.
Thank you, everybody. Thanks for being here. Mrs. King, may we have a roll call to establish a quorum?
Here.
Present.
Here. Now we'll have the Board of Education norms.
The Riverview Gardens School Board will operate as a cohesive team. Will operate as a cohesive team. We will remember to put students at the center of every decision. Pause after someone speaks to hear all voices. Consider and respect all opinions without judgment. Strive to assume positive intentions from all members. The board will honor the board policy related to the implementation of Robert's Rules of Order. The board will utilize collective agreement to honor the decisions of the board, policy BBF, school board member ethics. Use collective voices to reach decisions, honor and respect the work of the board, honor and support board decisions at all times, align with board policies and procedures. The Board of Education members will be prepared for meetings. The board will review the packet details and submit questions within the established timeframe. Questions at meetings should be limited and specific to information not presented in the packet details. No surprises at meetings. Extend a courtesy for members' questions. Members of the board will arrive 10 minutes prior to the start of meetings if possible. Administration will release board packets to the Riverview Gardens School Board of Education within the identified timeframe. We will not allow outside entities to dictate board actions. Riverview Gardens School District Board of Education decisions will be made based on facts, policies, and procedures, not individuals' opinions or requests. We will educate and encourage the community to follow proper protocols for voicing concerns, policy KC, community engagement.
Thank you, Dr. Coleman. May we have a motion to approve the agenda?
Madam President, I would like to amend the agenda.
Yes, ma'am.
I would like item G under items for discussion to also be added to as item B under items for action. And that item G would be the employee benefits market review and recommendations.
Item G.
Item G under items for discussion also be added to item B, items for action.
Thank you, Dr. Coleman. Now,
Dr. Pat.
I'm sorry, Dr. Patty. Now, can we have a motion to approve the amended agenda? Ms.
Second.
It was approved by Ms. Williams, second by Dr. Coleman. All in favor, aye. Any opposed? No opposed? Thank you so much. Now we're ready for Riverview Excellence.
Mr. Sistrunk.
Good evening, Board of Education Directors, Dr. Patton, colleagues, and community. I think we have not sure if she's a scholar, but and the children as well. Welcome to our Board of Education meeting. Today, for Riverview Excellence, we're honoring a very special, very involved person in the district. If Mr. Marvin Krumer can stand. Mr. Krumer is the Director of Parks and Recreation for the City of Belle Fountain Neighbors. And Mr. Krumer is very involved with the district. Over the winter, I'm sure you remember because you helped foot the bill for it. But our high school had a water main break and it flooded the gymnasium, the basketball floor, the workout center, pretty much everything. And during that time, the City of Belle Fountain Neighbor, under Mr. Krumer's leadership, they invited the high school scholar athletes to come and work out in their facilities so they would still be able to practice and train and work out. The City of Belle Fountain Neighbors has also been involved in toy drives and giveaways, clothing and coat drives. And also saw Mr. Krumer last night at the Back to School Bash, manning a table for Belle Fountain Neighbors. So we want to give them their flowers for Riverview Excellence, especially Mr. Krumer is always here and always willing to serve the students of Riverview Garden School District. So Mr. Krumer, if you can come on up.
Just a few words. Yeah.
Just be very brief. I definitely appreciate this honor. This is pretty much for all of the hard work that my staff does. You know, I'm just there with them, trying to guide them, but we put in a lot of hard work just helping the community and doing whatever we can. So on behalf of the Rec Center and the City of Belle Fountain Neighbors, thank you.
Thank you.
And actually, Mr. Krumer, if you can come up, we'll have you take a photo with the board. That's our only Riverview Excellence for today. And we definitely appreciate your service. Like I say, we always see your face. We get lots of information on community events from Mr. Krumer, and so we definitely appreciate you. And also, I want to recognize Mayor Avant. She snuck in here. I didn't see her back there, but thank you for coming, Mayor Avant. And that concludes Riverview Excellence.
Thank you, Mr. Sistrunk. Mrs. King, do we have any public comments? None. Are there any announcements from the board members?
Yes, Madam Chair, in preparation for our fall regional meeting, I will be meeting with our executive board for Region Number 7. And I wanted to make just a quick statement with regards to, I guess I would call it fiduciary responsibility. And so one of the things that we noticed, and I don't believe in keeping secrets. So one of the things that we noticed when we were at Tantara was that during some of the sessions, we saw more people outside of sessions than we saw inside of sessions. And, you know, I think that when school districts pay money for you to attend events, it's important that you go to those sessions. So one of the things that I am going to propose to them is that we take a look at the way that they're doing attendance in those sessions. Some time ago, you used to have to pre-register. They would send you that information, you pre-registered for it, and you decided what you were going to take. And then they had a listing of what you were going to take, and then they trusted you to, when they scanned you in, to stay in the session. And it was just a concern to us with some of the things that are going on with the government right now, our Missouri legislators. So I'm one of the things I'm asking them to do is to help us be more diligent. I think a lot of people looked at that as an opportunity because we had not been there for a while to do other things, but what their district paid for. So representing not only Riverview, but representing Region 7, we're going to try to put a stop to that. If your district paid for you to attend the event, you should be 10 classes at the event, you should be in class. So I just wanted to let you all know.
Thank you, Ms. Morreale. Any other comments from any board members? None? Okay. So now we're moving to the consent agenda. Can we have a motion to approve the consent agenda as presented? With the amendment? No, that's under items of discussion. Okay. Just to approve the consent agenda.
So moved, Madam Chair.
I'll second.
It's been moved by Ms. Williams, second by Ms. Morreale to approve the agenda, the consent agenda. All in favor, say aye.
Aye.
Any opposed? No opposed. Thank you so much. Now we're moving to Dr. Patton's superintendent report.
Thank you, Madam Chair. I want to say thank you to everyone who came out yesterday. We had hundreds of people at our back to school bash, hundreds. It was a hot one. It was a hot one, but we survived. We had hundreds of students and their families. There were backpacks with school supplies. We had vendors with ice cream, corn. I don't get the corn, but burgers and hot dogs and chips and haircuts and alpacas. I don't get the alpacas either. But there was a great time had by all. We had hundreds of people there, and I do want to do a special shout out to our partners who were out there. They gave us the Book Bags Little Bit Foundation, as well as some of our new partners that came on. We also had Soul Fishers out getting students registered for after-school care. It was a great, great, great event. It was a hot one, but it was a great event. And so thank you to everyone who came out. I do want to recognize the Student Support Services Department, Ms. Liddell and her team for organizing the event. They did a great job organizing it. We had to shift because we typically have it on the front lawn of the high school. However, there was construction happening there. We couldn't have it there. We shifted. It was seamless. So I do want to let Ms. Liddell know, great job, as well as her team, as well as everybody. We have building principals and secretaries and employees and everyone out. It made it a great event. So thank you, thank you, thank you. Next year, we will plan it on a cooler day. Keep your fingers crossed. We welcomed all of our staff back today. And so they started today. I made some rounds. I hit 6 or 7 schools. Building leaders were doing professional development. They were deeply involved in looking at their data and their student performance and planning for this year to be effective. So I do want to thank all the principals for the hard work they did to welcome their staff back to campus, and then to the custodial staff who also made sure that the buildings were ready. We still have some of our buildings getting ready, but the majority of the buildings were. The rest of the week will be involved, our students, our staff for the next 2 weeks will be involved in professional development. We have K2 teachers that will be involved in the U-Fly training for the foundational skills of reading. And then they will also be involved along with the third, fourth, and fifth grade teachers and on Amplify. So we have a lot of professional development that will be happening this week, all with the goal of helping student achievement. So I know Dr. Ramsdale and his team have been working hard, so thank you for that. They also hosted the new teachers last week. So we had 3 days of new teacher training. Dr. Ramsdale and the CNI department, as well as other department leaders. Dr. Ramsdale and his department organized it. Other department leaders presented. Our new teachers were properly welcomed on our 2 Riverview Gardens. Also, on July 28th and 29th, we had the Riverview Gardens Leadership Academy right here in our boardroom where our buildings leaders came in. They looked at their data collectively, and then they started planning collectively. So Ms. Nave and her team did a great job of that, as well as other department leaders who presented there as well. So thank you for that. It was very well planned, all of it, and very well put together. So thank you to this team that I am fortunate to have. Our convocation is tomorrow. Ms. Liddell will, by Thursday night, Ms. Liddell will sleep well because she's been in planning heaven, or yeah, I'm gonna call it heaven, planning heaven. And we will officially welcome our staff back tomorrow. We will have it on our high school campus for the first time in a few years. So we'll welcome back our staff, and then on August 24th, we will welcome back our students with a full day of learning. I want to remind our parents that boundary changes has resulted in some of our students being assigned to different schools. Letters went out in April. They went out again last week. They'll go out again this week. We've had social media postings. If they will pull it up, Tim, if you will pull up, last week, Ishmael even sent out a reminder just about where to access it. So if you click on Find My School on our website, if you go to our website, families click on Find My School, right up there you can put your address in. So if you'll put in 1370 Northumberland, which is the district's office address, all parents have to do is put their address in. And once you click in it, it will show you all 3 schools. It'll show you the elementary, middle, and high school that students who live at your address is assigned to. So for the parents that have shared with us that they haven't gotten anything, please go to our website, click on Find My School, put your address, and it will tell you what school your student is assigned to for the 26-27 school year. We will also send out another reminder tomorrow. We have done our due diligence in communicating. It's been everywhere. It's been on social media everywhere, our website, Find My School. I've shared it. So parents, please, there were some changes this year. So your students will be attending the new school that's assigned to your address. Make sure you get them registered as soon as possible because the first couple of days will be very busy days. And so registration will only take place online. You can only register online those last couple of days because the office and the buildings will be very busy making sure we get our school year started off right. So I want to welcome our staff back. I want to welcome everyone back. We've had a great start to the 26-27 school year, and we are looking for things to get even better as we move forward. Madam Chair, that concludes my announcements.
Thank you, Superintendent. Now we're moving to items for discussion.
Thank you. Our first item for discussion is the Conflict of Interest Ordinance. This is in conjunction with Policy BBFA, Board Member Conflict of Interest and Financial Disclosure. And making this presentation is Ms. Demetra King, Coordinator to the Superintendent. Ms. King?
Good evening, President Lane, Superintendent Patton, and the entire members of the board. This evening, the board is being asked to readopt Policy BBFA, board members' conflict of interest and financial disclosure. Missouri law requires political subdivisions, including school districts, to maintain a written policy addressing financial disclosure and conflicts of interest. The Missouri Ethics Commission also requires districts to readopt the financial disclosure portion of the policy in an open meeting at least once every 2 years by September 15th. Policy BBFA establishes the district's requirements regarding conflicts of interest, financial disclosure, gifts and gratuities, nepotism, confidentiality, and other ethical responsibilities for board members, candidates, and designated administrators. Readoption of this policy ensures that Riverview Gardens School District remains in compliance with Missouri law and Missouri ethics requirements. Once approved as an item for consent at the next board meeting, Ms. Fields will send a certified copy of the updated policy to the Missouri Ethics Commission within the required 10-day timeframe. Administration is presenting this recommendation for discussion, and a recommendation for readoption will be presented at the next board meeting under items for consent. Do you have any questions? Thank you.
Ma'am.
Thank you, Ms. King. Our next item up for discussion is board governance. Making this presentation is Ms. Wanda Lane, our board president, and this is in conjunction with policy BBF, school board ethics. Ms. Lane?
Background information. On September 30, 2023, the Special Administrative Board participated in a governance workshop facilitated by the Missouri School Boards Association, MSBA, which included team building, board collaboration, and the development of board norms. The board subsequently approved the board norms on October 10, 2023, to establish shared expectations for governance and ethical conduct. At the October 14, 2025 Board of Education workshop, the board approved a motion to continue the discussion of the board norms at a subsequent virtual meeting to allow members additional time to review the proposed language and submit recommended revisions. On November 8, 2025, the board engaged in further discussion regarding the proposed board norms, addressed questions raised by board members, and considered the recommended revisions. Following that discussion, the board approved its current board norms. As the board continues its commitment to effective governance, board president has requested that the board discuss whether to temporarily suspend the current board norms until a board governance meeting is held. The purpose of the governance meeting would be to provide the board with an opportunity to comprehensively review the existing board norms, discuss any proposed revisions, and determine whether to reaffirm or amend the document before resuming their application. Justification. Periodic review of governance practices promotes consistency, accountability, and effective board operations. A temporary suspension of the current board norms, if approved by the board, would allow members the opportunity to evaluate whether the existing norms continue to reflect the board's expectations, governance priorities, and commitment to ethical and collaborative leadership. The policy reference is BBF, School Board Member Ethics. the recommendation, conduct a discussion regarding the temporary suspension of the current board norms pending a board governance meeting and provide direction to the administration regarding the board's desired course of action. Originator and presenter Shay Fields, coordinator of board governance, Wanda Lane, board president. Are there any questions? Are there any comments? Thank you.
Thank you, Ms. Lane. Our next item up for discussion are policy recommendations. Making this presentation is Ms. Jennifer Williams, our Human Resource Manager, and this is in conjunction with Policy CH, Policy Implementation and Dissemination. Ms. Williams?
Good afternoon, Dr. Patton and board members, community and colleagues. I just want to apologize in advance. These policy recommendations went to the board or the board meeting on July the 14th. So tonight they would have been scheduled for consent. So I do not have any items to present tonight. Thank you.
Thank you. Thank you. Our next item up for discussion is the first student transportation agreement. Making this presentation is Ms. Tracy Nave, the Assistant Superintendent of School Leadership and Accountability. And this is in conjunction with policy EEA, Student Transportation Services. Ms. Nave?
Good evening, members of the board and Superintendent Patton. Tonight, I am requesting your approval for a one-year contract extension with First Student Transportation Services for the 26-27 fiscal year. To provide just a brief background, the Riverview Gardens School District completed an RFP or request for proposal for student transportation services in June of 2020. First Student was selected as the lowest responsible bidder at that time and was awarded a 3-year contract spanning fiscal years 21 through 23. For the subsequent years, extensions were granted in April 2024 for the 24-25 school year, and again in June 2025 for the 25-26 school year. Given the ongoing nationwide driver shortage, continuing our partnership with First Student allows us to maintain continuity and to avoid critical disruptions in transportation services for our scholars. Our primary objective is ensuring our students arrive at school safely and return home safely every day, which directly supports our comprehensive school improvement plan goal to increase daily student attendance across the district. Under the terms of this proposed one-year extension, there is an increase of approximately $55.24 across all rates compared to the previous year. So this expenditure is budgeted. The financial commitment is not to exceed $2 million. Funding will come from the designated account for our transportation. And again, this request aligns with board policy EEA regarding student transportation services. The administration recommends that the Riverview Gardens School District Board of Education approve this one-year contract extension with First Student Transportation for the 26-26 year. Thank you. Are there any questions?
So there's an increase of $55.
Just across many of the, and I don't have it in front of me, but there should be a table that you would have received along with this document that shows different increases that they may have had from the home to school routes, the activity routes, what we would have paid for athletics, transportation to games, any field trips. And so it was very minimal, but across the board, it was only a total of about $55 as far as an increase of the services, of how much they were charging for each service. $55 total. When I added up all of the increases across the board for home to school routes, athletic routes, field trip routes, all of those routes, it was just about $55 total.
Ms. Nate, I'm sorry, go ahead. Ms. Nate, there is no gas transportation costs included in any kind of negotiation, or is that already established?
So one of the great things about this, we've already established that is, as far as First Student with us, we provide them with the office space. We also provide them with a lot to park there, and we also provide them with a diesel fuel service. And so they are using the fuel service with us, and in exchange, it's ours. And in exchange, we get a lower rate.
So it seems like we're very pleased with this.
Yes, sir.
Then my question is, we're only granting a one-year contract?
So in order to keep a continuity of service for this upcoming year, we are still working with First Student to get a 5-year extension that would include the new EV buses, the clean buses. We're going to have a fleet of electric buses that will come. The district will own 2 of those buses out of the 7 that we have, or 6 that we have.
So we're working on another 5-year contract?
Yes, we just need to work out the logistics regarding the electric buses.
Okay.
Thank you.
Thank you,
Thank
Ms.
you.
Neve. Our next item up for discussion are MOUs for student support services. Making this presentation is Ms. Deirdre Liddell. She is the Executive Director of Student and Community Support Services, and this is in conjunction with Policy DJF-2 Purchasing. Ms. Liddell?
Greetings to the Riverview Gardens Board of Education, Dr. Tanya Patton, colleagues, and community. As a school district, we are very fortunate to have so many services and MOU partnerships that extend both throughout the day as well as after school and for summer activities. We are committed to continuously identifying and establishing new partnerships that create healthy school community, as well as finding access and making sure we have access to quality learning opportunities for all students. The MOUs I bring before you today are St. Louis Community College Preventative Dental Care, which would provide additional dental care for our scholars, which includes screenings, cleanings, fluoride treatments, oral health education, as well as referrals to additional dental care when needed. The second MOU is Affinia Healthcare. Affinia provides comprehensive healthcare services for all families, including primary medical care, behavioral health, dental service, WIC, nutrition education, and mobile health services, as well as care coordination. The next MOU is 100 Neediest Cases, which provides financial assistance as well as essential resources to families and students experiencing hardships. This support may include foods, clothing, school supplies, household necessities, emergency assistance, as well as holiday support. The next MOU that we have is YWCA. This provides high-quality early childhood education and school readiness services for young children and families. The next MOU is the Alpha Kappa Alpha Youth Leadership Institute, which provides scholars leadership training, character development, and college career exploration, as well as civic engagement and financial literacy. The next MOU that we have is Vision for Children at Risk, which offers family counseling, parent education, case management with trauma-informed support. The next MOU we have is Civitas, which is a model UN experience for scholars to help develop leadership, public speaking, critical thinking, as well as global awareness. And then the last MOU that we have is Smart Kids, Inc. Smart Kids, Inc. will provide free academic tutoring and educational support to help all students succeed, both in school hours as well as after school hours for tutoring. Are there any questions regarding any of the MOUs? All of them are free services to the district.
So these are additional, Madam Chair,
Yes, ma'am.
these are additional services that we have. Some of the other ones are still ongoing, or this is it?
So these services, some of them we're bringing back because they have yearly MOUs. So our 100 Neediest Cases, YWCA, Alpha Kappa Alpha, are the our MOUs that we're continuing after the 1-year MOU. St. Louis Community College Preventative Dental Care is a brand new MOU. Affinia Healthcare is a new MOU. Civitas is a new MOU. And then Smart Kids, Inc., we had an MOU for a summer program, but they're wanting to expand their partnership to do tutoring throughout the year.
Madam Chair, I do have a question.
Yes, ma'am.
Ms. Liddell, the Smart Kids Inc., will that be available at all schools, the tutoring, or how does that work?
No, ma'am. So Smart Kids Inc. will be available at the Danforth campus location for at our Success Center. And then, also available at the high school. So they will service, our Success Academy, high school, and then any scholar that lives in the Danforth area will be able to do tutoring at that site.
Thank you, Ms. Liddell. And you should stay put. Yours, you have it, the next one up. The next item up for discussion is the Rams Health Clinic, Family Care Health Centers. Making this presentation is Ms. Liddell, and this is in conjunction with the same policy DJF purchasing.
Okay, so Care Health Centers is partnering with our school district to open a new Rams clinic. The clinic will provide preventative care, annual physicals, immunizations, treatment for minor illnesses and injuries, chronic disease management, behavioral health screenings, health education, wellness promotion, and referrals for specialized medical and dental care when needed. They will also help families enroll in both Medicaid and other insurance programs. Bringing healthcare directly into the school community will help us remove barriers to learning, improve academics, promote academic excellence, and strengthen overall health for students and families, as well as hopefully help with attendance, to make sure that we have those students in school, being able to be seen at the clinic when they're not feeling good, and then going back into classes. So with this MOU, it is no cost to the district. They will be using our space. Family Care Health Centers is a federally qualified health center, so they will bill Medicaid, private insurance, and any other eligible third-party payers, as well as work on a sliding fee scale. So no student will be turned away if they don't have insurance, but they will be helping families gain insurance, sign up for insurance. And with that, it really helps because they're changing the rules for Medicaid where they'll have to reapply every 6 months, as well as there is a workforce requirement that is taking place as well. So even if they're not using the healthcare center, they can use for assistance with insurance. Are there any questions in regards to Family Care Health Centers and the new Rams Clinic?
Yes.
Mhm.
I have a list of, dates that I'm storing.
Mike.
I have a list of dates that I'm gonna start visiting, other communities in, at River Garden Services. And I would like to present that information to the mayors of that community. Do you have any brochures that I can share with the community?
So I do have a flyer. And then also, I can get more information. We've been waiting until the MOU was cleared before we receive all of the information from them, but we will be working with their communications department as well to get more information. But I do have a flyer that I can share today.
Okay, that'd be great.
Mhm.
So since Mayor Elliott is here, she already has that information, so you'll share that at your next meeting, right? Thank you.
Thank you.
I have a
Mhm.
question.
Uh-huh.
A couple, three. So you said using our space. First of all, where will these clinics be? Will they be in all our schools? The high school has a clinic that I was under the impression we were in partnership with Christian Hospital. I don't know exactly all the status of all of that. And can you explain, you said something about workforce requirement to receive Medicaid? Is that for the student or for the family?
It's for the family.
So
for
we
the
will be
parent.
seeing family as well as students?
No, ma'am. So they're doing some changes to Medicaid throughout in regards to putting additional criteria on those who can receive Medicaid. So with that, they're adding a workforce requirement to that. And then also not only that, but they have to renew every 6 months now for Medicaid. So there'll be people there, there'll be health workers, community health workers there to help families reapply and go over all of those different criterias to make sure that they're able to keep their Medicaid services and then also complete that paperwork in a timely manner so there's no lapse in insurance.
That's really big for this community.
It is.
Mhm.
I mean, that's very big and that needs to be publicized, like you said, Mr. Williams.
Mhm. Yes,
So
ma'am.
what about the space at the high school?
So the Family Care Health Center will utilize the space at the high school for both dental care and health care, and then behavioral health care. There will be some rotating schedules that we still need to fine tune and work out in regards to in regards to their schedule and our schedule and what's best for the scholars. And then also we did have a partnership when the Rams Clinic first started, there was a partnership with,
KRSTL.
well, it was CareSTL, but first it was
It was
Christian.
Yeah.
Yeah, first it was with Christian. Well, since then, CareSTL has their services are no longer open. So with that, we were looking for a new community-based partner.
So just as more background, Ms. Lane, in 2020, pandemic happened. We were supposed to open the clinic way back. Pandemic happened, threw everything off. Everything became more costly, so they put it on hold. During that time, Christian Hospital was not a part of it anymore. So Riverview Field, we finished the build out of the healthcare center, and then CareSTL staffed it. And then as Ms. Liddell shared, they have since, I think they
Closed their doors. Mhm.
And so we have been looking for a new partner for our high school. And Ms. Liddell was able to find a new partner that will help staff it to keep our students at school and also to support our families.
Thank you, Ms. Liddell.
Yes, ma'am. So there's an hourly requirement now. I will have to look into that. I want to say they have to work at least like 20 to 30 hours in order to keep their Medicaid, but I can get all of the specifics in regards to the new workforce requirement for Medicaid. Are there any additional questions?
All right,
Thank
thank you,
you.
Ms. Liddell. Our next item up for discussion is the Employee Benefits Market Review and Recommendations. Making this presentation is Ms. Stephanie Terry. She is the CFO, as well as Ms. Bridgette Gilliam. She is our Benefits Coordinator. This presentation is in conjunction with Policy GCBC, Professional Staff Fringe Benefits, and GDBC, Support Staff Fringe Benefits. Ms. Terry?
Good afternoon, Board President, Board members, and Dr. Patton. As a part of the district's transition from CSD Trust, Insurance Trust Administration in partnership with USI Insurance Services, they conducted a comprehensive market review of our employee benefit options for the 26-27 plan year. Tonight, the USI team will present the results of the market review, including the options evaluated, proposed benefits, plans, financial impact to the district, and administration's recommendation. This is a time-sensitive item as board approval is necessary for us to move forward with implementation and prepare for employee open enrollment scheduled for August the 24th through September the 11th. At this time, I would like to turn the presentation over to our partner at USI Insurance.
Good evening, everyone. Thank you for having me. I must admit, my first introduction in 1991 to Riverview Gardens was a bit humbling. In a basketball game, a very large center dunked over me. And that was my introduction to Riverview. They had a very, very good basketball team back then, so
So you
I've been
all
around the
lost.
block.
That's what I heard. You
We
all
definitely lost.
Okay.
But no, happy to be here. This was a big change that you all elected to do and you entrusted us with helping find some solutions, and that's what we're gonna talk about today. So basically, in here, when you come out of something like CSD, our job becomes we work the market. So we solicited carrier proposals for the medical, dental, vision, and life insurance. We did a lot of side-by-side evaluations, evaluated the benefit designs, network cost, and all ancillary. Obviously, the recommendations were based on your all's priorities, which include financial impact and also the impact to district employees, finding something cost-effective for both the district and employees, as well as limited disruption to staff. So the great news on page 3 is the medical plan designs were able to be matched identical to what is in place today through the CSD program. So if someone's enrolled in the base, buy-up, or kids plan, their benefit is going to look exactly the same for the 26-27 plan year. Conversely, actually, CSD did end up making changes that did adversely affect some of the plan design. So actually, you're actually ahead of where they would have been from a plan design perspective. Page 5, a lot of numbers. I understand that, but we think it's important to show all of this. It is good news. Okay, so on page 4, we're looking at these are total monthly rates of the plans. Okay, so the top plan is what we refer to as your buy-up. That would be your most expensive plan that people have the ability to buy up to that plan if they'd like. The standard plan in the middle is basically the plan that the district builds their budget off of. And then there's also the kids medical plan that is a bit of a different nuance that CSD has had in place. Anthem is the only carrier that we solicited that was able to keep that in place. So that's good news because there are a fair amount of people that take advantage of that. If we look over on the right, it gives a brief synopsis of financially what these offers meant. Anthem on a standalone basis with Riverview is a $720,000 savings from what is currently being paid. Cigna came in and matched your current rates, and United Healthcare came in significantly above the current rates. So that's good news that Anthem was the carrier already in place. So that's wonderful for staff and keeping continuity. The employee deduction comparison is also very good news for your staff. And we tried to follow down below is kind of how the school has showed to their staff over the years. And so we tried to keep it consistent. So to kind of walk you through this, and I'll start with the top on the buy-up. So we show what currently is paid by the district, what will be paid now, which is certain, it's obviously lower. What also means it's going to be lower for the employee. So if someone buys up to the employee only, they're going to pay $119 rather than the current $133. To add a spouse is a little over $100 less expensive per month. Children about the same, and family about $200 less per month. You'll see that on the standard plan as well. Obviously, you guys fund that, so all of those savings are district savings. The difference between the 1061 and the 952. To add a spouse on that plan is about $113 less expensive, about $100 less expensive for adding children, and also about $200 to add full family. So that's great news, and obviously that is with Anthem. On the dental, medical obviously is the big driver. Dental is a little bit different story, unfortunately. Though if we're going to have one be great news, the medical is the better one. Dental is one. So one way to look at it, the reason the pricing is less on the medical is because Riverview is performing better than the CSD as a whole. Okay, so over the last few years, when we analyze your data, basically Riverview was helping support schools that weren't running as well. Okay, so now obviously, when you come out of that, you're priced based on how you're operating. Dental is kind of the opposite, is that the rates that were being charged for dental were actually not sustaining on your own. Okay, so that's where the increase came from. Delta Dental, which is the current provider that is in place, was the most competitive by quite a bit. So the plan design will remain exactly the same. All the providers will remain the same, so that stays consistent as well. Vision, it is currently with Anthem. Anthem also proposed being able to keep the same exact rates for Riverview, so that's great news as well. Life and AD&D, that's another one where definitely the volume of CSD helped where those rates were. Lincoln, who is the current provider at CSD for life, unfortunately was not competitive. The Standard is another it's an A-rated carrier. They do partner with Anthem. Basically the Standard, Anthem used to do their own life insurance. Now they've basically gotten out of that business, and Standard is their partner company. So there is a small increase there on the life of about $3,000. And then the voluntary life, which a number of people take advantage of on their own, matched current optional life and accidental death and dismemberment plan in place. Employee rates remain the same. Spouse rates do change. This is something we weren't able to duplicate. Spouse rates for life go from a set rate to age banded, so that those can vary a little bit. Dependents can get optional life when employees enroll moving forward. In the past, they actually were able to just get dependent life if they didn't take it on themselves. People that currently have those policies, though, will be grandfathered in going forward, so that's good as well. Page 10 is kind of an overall synopsis of what the premiums have done on all of those lines. So basically, if we combine everything, the overall change in total premium is a savings of about $672,000. That said, if you had remained in CSD, there would have been an increase of 7.6%. So they're underlined at the bottom. If we actually compare to what you would have had to pay by staying in CSD, the savings is about $1.27 million, which obviously that's a big difference. And it speaks to the great decision that staff and you all made in kind of doing something different for the coming plan year. Questions, anyone?
What does age banded mean?
So those are 5-year age bands. So if you're younger, you pay a little less. If you're 26 to 30, you're going to pay $1 amount for the coverage. If you're 50 to 55, like I am, I'm going to pay a little bit more.
So we're penalized for living long.
Yes, you could look at it that way.
Okay, thank you.
You're welcome.
So with your base plan, there's a deductible of 20%.
I'm here for you, Mr.
So with your base plan, there's a deductible of 20% on each one of the occurrences.
On the base plan, the base plan has a $3,500 deductible, and then 80% and a maximum out of pocket of $5,000 per year. Per year.
And the buyout plan?
So what isn't shown here is there are what CSD called corridors. And those the plan that's beneath, though it shows the same deductible, there are also HRA reimbursements that come directly from the plan that is priced in here. But it's, HRA is what's called a health reimbursement arrangement, and CSD called those corridors. And those what are in place and will pay toward each of these are built into the plan as well.
So with, United Healthcare, do you have a parallel that you can show us that how, even though United Healthcare is more at the end of the year, how would that save the, employee? See, right now you have a high deductible. I say it's high, but with, United Healthcare, a little bit more expensive. What is the end outcome?
Oh,
I-
so the deductibles that each carrier quoted would be identical to this. So it's not that they're more, they're more for the same level of benefit. Is that what you're asking?
Yes.
Yeah, so United Healthcare is just, we asked for the same exact plans from every carrier. Okay, so they didn't arbitrarily just pick a different plan design. They matched what is in place with CSD, and they were just, they're high, not just on your group, they're high with a lot of groups we're seeing right now. They were just uncompetitive in this situation, both in price and in benefit.
Is it possible you can show that to us? Can you email it to?
Absolutely, sure. Yeah, of course.
So we have a comparison,
Yes.
review.
Yes. Yes, we can.
So what happened to United Healthcare?
I met with their leadership earlier this year, and they pretty much, because they had been very active in the marketplace. They pretty much said it's going to be 2027 before we see them competitive again. They're not negotiating much on the renewals we have going on with them, and we usually write a lot of new business with them across industries. We maybe have written 1 or 2 accounts with them this year. We usually write probably 10 to 15. So they were pretty upfront that they are just kind of, and carriers go through this, they're being probably a little bit more conservative than we've seen in the past. They go through times where they focus more on profit rather than growth. And so what they're doing, unfortunately, is they're, at least what we're seeing with our groups, is that they're the groups that they probably don't want on their books. We're seeing a little bit higher renewals, and then they're just not being very aggressive in the marketplace right now to write new business. That will change. They're a great carrier. We do a lot of work with them. But right now that is that has been their philosophy, at least here in 2026. And we're hoping that changes next year.
Any additional questions? Okay,
All right.
thank you.
Thank you.
And I just wanted to restate that one of the main things that I talked when I worked with USI was we wanted to have as least disruption to the employee. So that was one of the main things that I told them. I said, we cannot afford, we've already increased the prices last year. We cannot afford to cause a lot of disruption to the employee. But I do also want to restate that the overall savings is $672,000. So that's so I think is in alignment with the decision that we made. It was a great decision pulling out at the tail end. And you guys know how much this stressed me at the last minute coming to the board for approval for that. So thank you.
And if we had stayed with them, it's $1.2
$1.2 million was the overall savings. And also in comparison, CSD Trust is making everyone go to a standard plan. So we still have 2 options. Yes. So.
Very good.
Thank
Okay.
you.
Our next item up for discussion is the Cerelec's new Affordable Care Act tracking and reporting. Making this presentation is Ms. Stephanie Terry and Ms. Bridget Gilliam, our benefits coordinator. And this is in conjunction with policy DJF. Ms. Terry?
Hello again. Tonight, we are presenting Celerex for discussion with approval requested at the next board meeting for the district's ACA tracking and reporting administrator for 26-27 plan year. So why this is needed? As we transition away from CSD Insurance Trust, the district must now assume responsibility for ACA tracking, which is Affordable Care Act.
and IRS reporting services that were previously provided through the trust. With Cerealex, the benefit department reviewed available options, and Celerex was determined to be the most cost-effective solution while also providing strong integration with our benefits administration system. So what will Celerex do? Celerex will track employee eligibility, maintain ACA compliance records, and prepare the federally required 1094C and 1095C forms while reducing manual processing and the potential for reporting errors. So the financial impact to the district, the annual cost is $4,800 plus sales tax. That's what we were quoted. And the expenditure is budgeted within the general operating budget. And we're just here requesting, recommend approval for Celerex to ensure continued ACA compliance and an efficient transition from CSD Insurance Trust at the next scheduled meeting. So it's basically a requirement that we have, and CSD Trust was performing that job. I don't know how well they were doing it, but they were performing that job. So we need to transition, and the cost is $4,800. And we will bring it back for
Are we
approval.
exempt from sales tax?
Yes, so it's just what they put in a quote, but we do have tax exempt forms, so that's negotiable.
Okay,
Okay,
thank you.
thank you. Any additional questions? Thank you.
All right, so Ms. Terry, I said Ms. Bridget Gilliam's name twice and she has yet to stand up. So I am going to call her out. Ms. Gilliam, stand up so everybody knows the wizard behind the door. Thank you. I will not be ignored, Ms. Gilliam. So, just so you know. She is our benefits coordinator. She's the wizard behind the door that helps support us. So thank you. Joined us last year. Oh, well, look at you. So I'm so glad I made you stand up then. Our next item up for discussion is our staffing plan adjustment. Making this presentation is Mr. Travis Ford, who is standing. Thank you, Travis.
Welcome.
Pay attention, Ms. Gilliam. Mr. Ford is our Assistant Superintendent of Human Resources, and this presentation is in conjunction with several policies: IHB, class size; GCA, professional staff positions; GCD, professional staff and recruiting and hiring; and GDA, support staff positions. Mr. Ford?
Good evening, board members, Dr. Patton, colleagues, and community. Each year, the proposed staffing plan is developed based on a projected enrollment along with the academic and operational needs at each school site. For the 26-27 school year, we are recommending adjustments that reflect updated district needs, which include parent allocation reassignments, reclassifications, and reductions. The recommended changes are intended to ensure that the staffing allocations remain responsive to the evolving enrollment changes, students, and school needs while maintaining a strong commitment to fiscal responsibility. The proposed allocation adjustments are funded by the General Operating Budget, the GOB. The staffing plan adjustment is being recommended with one change. As a part of our ongoing review of our district department and operational needs, the administration has decided to rescind the original recommendation to eliminate the two painter allocations and instead reclassify the two allocations under general maintenance to better support the overall maintenance and operational needs of the district. The proposed staffing adjustments are as follows: reduction of 9 instructional assistant positions across the district, a reduction of a part-time parent education screener position, reduction of 3 teacher allocations, reassignment of 3 teacher allocations, the reclassification of a district protection officer, and the additional temporary position of substitute nurse. The reallocations out of the general operating budget are budget neutral for the 3 teaching positions. The reclassifications for the district protection officer and the painters under general maintenance are budget neutral. And then the reductions out of the general operating budget for the 9 instructional positions, 9 instructional assistant positions, the one parent education screener position, the 3 teacher allocations, all total to an estimated total savings of $640,000 with the revision that was mentioned. It is recommended that the Board of Education, with this revision, approve the staffing plan adjustment as presented. Are there any questions? Thank you.
Thank you, Mr. Ford. Madam President, that was our last item, but I do want to take a moment. We lost one of our former employees who had been with us at Glasgow for a number of years. I think he was with us, he left and then came back, because that's what happens when people leave Riverview Gardens. They call him and say, "Do you have a spot for me?" So he came back to us. He left at the end of the 25-26 school year, but we just found out that he has passed away. So I would like to have a moment for Mr. Deron Lee, who was the home to school coordinator at Glasgow Elementary. Madam President, thank you for indulging. That concludes the items for discussion.
Thank you, Superintendent. Now we're moved to items for action with the amendment of item G, employee benefit market review, that's added to this item for action for this evening. Can we have a motion to accept the items for action, A and G?
Madam Chair, I so move.
Second.
It was moved by Ms. Moore-Real and second by Ms. Williams for the items for action. All in favor, say aye.
Aye.
Any opposed? No opposition? Motion carries. So we're now at adjournment. Can I have a motion for adjournment, please?
So moved.
It was motioned by Dr. Coleman, second by Ms. Williams. All in favor, say aye. Aye. Any opposed? No opposition. Thank you so much. And thank you so much for coming.